Hello, good morning everyone. Yeah, shooting a video almost after a week. Got busy in reading some very addictive textbooks and preparing another short book about it. So, anyways, but of course, I have not forgotten you all. I keep replying to your emails daily. And I've just switched my clinic for these 2 months because school vacations are going on, so children can come in the morning time as well. So I've changed my schedule, and that changing the schedule also had a lot of backlogs that I had to cover up, so I could not shoot the video. So anyways, from yesterday onwards, I've started working in the mornings, so I've started getting up more early in the mornings. So I thought, why not utilize this time, shoot the videos in the morning and then leave for work so that I can do other things with the rest of the day. Get more disciplined, So yeah, I would like to just continue the periodontal staging and grading that we were discussing, because this chart is not like a textbook format with scenario-based questions fabricated on it, which I have done it for your ease. And definitely questions are asked about this in the exam. Like all the exam going candidates who have given the exam at least once, or are watching this video even after clearing their exams, that questions from these are asked. They were asked in my exam as well. So anyways, I'll remove myself off from the screen because I really want you to see this chart, and like I have mentioned many times before, memorize this chart on the day of the exam. Before the exam starts, they'll give you a plain paper. Just reproduce this chart on the paper, because when questions like these, which we are going to discuss, will come, you have the chart to refer and immediately solve those questions correctly, and you're not confused at all. Alright, so let's start quickly with 3-4 questions and wind up for the day. Okay. Okay. What is the minimum requirement for a diagnosis of periodontitis? Okay, now this is a textbook question basically, not exactly related to the staging and grading chart, but it's for your information and you should know this. The minimum requirement for a diagnosis of periodontitis, not gingivitis, periodontitis, is that clinical attachment loss should be more than on 2 non-adjacent teeth. I'll put myself back in the camera. What does this mean basically? If you find while examining that 2 teeth on different sides, or 2 teeth on the same side but not next to each other, that is called as non-adjacent, on at least 2 teeth you find that the clinical attachment loss is present, then you can judge that case as periodontitis. Okay, it should not be a traumatic thing or something. It's periodontitis. It's an inflammation of the periodontium, not because of a trauma or something. It's a proper disease, a long-standing disease or an acute disease. So 2 teeth on non-adjacent side. It may be this molar, that molar, but if you find on 2 adjacent teeth, then it is not a periodontitis diagnosis. You get my point? It cannot be a premolar and a molar next to each other. It can be tooth number 4, it can be tooth number 6. It cannot be tooth number 5 and tooth number 6. That is the minimum requirement if you want to diagnose a case as periodontitis. Understand this, very important. Okay. Now, a case with interdental clinical attachment loss is more than 5 mm, and there is a vertical bone loss and a masticatory dysfunction. Very good. Now again we go back onto staging. What is staging? Staging of stage 3 and stage 4. What is the main difference? Both of them involve clinical attachment loss of more than 5 mm. So that's a similarity. So I still cannot make out if it's stage 3 or stage 4. Now I move on. In addition to stage 2, for stage 3, there is probing depth of more than 6 mm, but that is not mentioned here. There is vertical bone loss, that is mentioned here, so that is again a similarity. But anything about masticatory dysfunction is mentioned here? No. But masticatory dysfunction is mentioned here in stage 4. So you see, even though there are a lot of similarities between stage 3 and stage 4, this one word, masticatory dysfunction, classifies this question into stage 4. Correct? That is the importance of this chart, so that you don't get confused in the exam. So again, memorize this. This chart is available on Google as well. You don't have to like find out here and there. Download it, write it daily, and memorize this. Moving on to the next question. Which grading factor indicates a grade B periodontium? Okay, let's go on the grading. Grading decides or indicates the rate of periodontitis progression, responsiveness to standard therapy, and potential impact on systemic health. Basically, how severe is your disease? Is it progressing with slow rate, moderate rate, or rapid rate? This is what grading is all about. Now, grade modifiers is, see, by default you have to consider, if you have a periodontal case, that your patient is of grade B, moderate rate, okay? Then on seeing the further factors, when you ask the question, you will classify him as grade A or you should classify him as grade C. Understood? So what is our question? Which grading factor indicates a grade B periodontium? So grading factor, basically grade modifiers they are saying. No smoking, no diabetes, slow bone loss. Okay, is that the factor which is deciding a grade B periodontitis? Do we see here no smoking? No, that is not there. No smoking is a grade A and they are asking about grade B. So option A is wrong. Bone loss to age ratio is less than 0.25%. Now that is also a criteria of grade A. In grade B it is 0.25 to 1%. HbA1c is less than 7% and 5 cigarettes a day. Okay. Less than 10 cigarettes, 5 cigarettes, okay, that does come in grade B. HbA1c is less than 7%, which also comes here. Tooth loss due to trauma. Now, tooth loss due to trauma is not mentioned here, and tooth loss due to trauma is a staging classification, not a grading classification. Understood? So, out of all these options, the one which fits the description is grade B. Now, what's the difference between grade B and grade C? In grade C, there are more than 10 cigarettes and the HbA1c is more than 7%. Alright, so though diabetes is a common factor, in grade B the HbA1c is less than 7% and in grade C the HbA1c is more than 7%. Understood? So again, the importance of memorizing this chart. You won't have this printout in the exam. You have to make this printout by yourself by sketching it on the plain paper. You can take as many plain papers as you want in the exam. There is no restriction on that. So my suggestion would be take 2-3 plain papers. On one, make the periodontal chart. On another, make an eruption table chart. And the third one, keep for the calculation of local anesthesia dosage, which can be asked in the exam, correct? So these 3 things you write and keep, so it becomes way easier for you to answer the questions. And the last question for today, Miller's classification for gingival recession is replaced by what system in 2018 classification? Well, this you just have to learn and memorize it. There is nothing logical about it. It's Cairo classification system. Now that is the system which is used for recession type classification based on clinical attachment loss and interproximal attachment loss. So this question may be asked, may not be asked, but it's always better that you know this in case it's asked, you know, that on which system this is based on. It's Miller's classification is now changed to Cairo's classification system. Now, from where am I getting these questions? I have taken this question from this chart, and this chart is mentioned in the ADC resource. Where do you get the ADC resource? ADC resource is mentioned on the ADC website. There is a list of approximately 25 textbooks and articles which ADC recommends you to read them because it has fabricated questions from them. So what I have done is, I have done that tedious task of reading all those textbooks and compiled a book on it, which is called as the Ultimate ADC Written Exam Companion. And this book has all the topics mentioned in the ADC resource, which are like 21 books here, 21 topics here basically from those textbooks, and the rest of the 4 or 5 others is compiled into another book called as comprehensive book, which has questions from therapeutic guidelines, ODEL, infection control, ethics. All of those form like 30% of your exam. This forms the remaining 70% of your exam. This book has 1400 scenario based questions, approximately 583 pages this book is of, and it has questions approximately 60 to 70 on each index topic mentioned here. So few of these books you have read, most of them you have not read, and that's because we have been reading standard textbooks, but sometimes those textbooks are not being followed by ADC, and since you're giving an ADC exam, you have to read concepts from that textbook. Now certain concepts are different, that's not how you have been taught, but you have to answer the question what they want to listen to. So you have to read their material, correct? Now any exam going candidate obviously does not have time to go through all this and memorize, retain and revise, which I understand. So I have made this, I have studied the main topics from these textbooks and prepared questions. So at least you are able to solve and answer this, and makes it interesting also. It's humanly not possible to study all these things in a matter of 3 or 4 months and retain everything and reproduce in the exam. You'll go crazy. So I recommend studying like 5 to 6 hours a day. Read this book, read the comprehensive book, and solve the mocks, and I think you're set for the exam. So if anybody wants this book, I'm happy to share a sample copy with you of 100 SBQs. From each topic I've taken 10 topics and formulated 100 question sample book, so you can go through it, and if you like it, you can purchase the Ultimate ADC Written Companion book by emailing me. And yeah, I'm always happy to answer any of your questions. Leave it in your comments, and have a nice day. Bye bye.